Drug addiction has been one of the most serious public health challenges of this past century. There's so much good information out there, but there's also a ton of misinformation. All right, so I'm going to just take a few minutes here to go over 3 common terms in the behavioral health world that are important to understand, but that are often used interchangeably. All right, so I'm going to talk about drug abuse, drug misuse, and addiction. It's tough sometimes for the general public because a lot of the language and the terminology, it does change so quickly, but it's important to keep up with because understanding the distinctions is what will ultimately dictate the appropriate level of care. Okay, so then what is misuse? Drug misuse is generally associated with prescription medications. Prescription medications are meant to be taken specifically as directed by a doctor. Okay, this is because these types of drugs can have all kinds of adverse effects if the directions aren't followed exactly. So we would say that misuse happens when the substances are taken for a purpose that isn't consistent with the medical guidelines. All right, that would include the wrong dose, taking a drug at the wrong time, taking it for reasons other than what was prescribed for you, taking a drug that was not prescribed for you, it was prescribed for somebody else. Okay, like these are all ways that we can misuse something. A couple examples. You have a prescription for Ambien. All right, directions read take 1 tablet every night as needed for sleep, but some nights you need to take 2 tablets. Okay, that's an example of misusing that drug. Not the end of the world, but it's something that we need to classify. Okay. Another example: you're given a prescription for a Percocet. All right. Bottle reads 1 tablet every 4 to 6 hours as needed for pain, but you take 2 tablets every 4 to 6 hours as needed for pain. All right. You are misusing that opiate in this example. Third example: you are written a prescription for an antidepressant. Okay. Bottle reads take 2 tablets every day. You don't like the way that it makes you feel, so you just start taking 1 tablet per day. All right. These are all examples of misuse. All right. So then how is drug misuse different than drug abuse? The main difference between a person who misuses drugs versus somebody who abuses them is their intent. All right. Like the former takes a drug to specifically treat an ailment. The latter is taking a drug to elicit a certain feeling. That's the difference. All right. So drug abuse happens when the drug is misused for the intentional purpose of getting high or inflicting some kind of self-harm. All right. Here's an example. You're prescribed Adderall. All right. Directions read 1 tablet 2 times per day by mouth. And then you take 1 tablet, or you use 1 tablet 2 times per day, but you snort it. All right. That's considered abuse, not misuse, because even though, you're taking your 2 tablets per day and just like the bottle says, and you're not running out early and you're not going out on the street to get more when you run out, the directions didn't read crush and snort. So, so that is considered abuse. So you are doing that specifically for the intention of getting high, getting the buzz from the quick absorption of that drug. In this example, are you addicted to Adderall? I don't know, maybe you are, maybe you aren't, but you're certainly going beyond misuse of the prescription here. So that's what's, now referred to as substance use disorder, SUD. It's very similar to alcohol use disorder, AUD, like I just talked about in a video a few months ago. If you want to go back and check that one out. The term disorder gets attached here because people who abuse drugs, experience significant changes in their thinking, changes in their behavior. So we have to kind of classify that as such. All right. So then what about addictions? Well, drug addiction is going to be known as, like severe SUD, okay, like severe substance use disorder, kind of like how alcoholism could be considered severe AUD. All right. Drug addiction, by classification, is a brain disorder that kind of manifests as the uncontrollable use of a drug or a behavior despite these consequences. All right, people with drug addictions have that physical and/or that psychological desire to use the drug because when it gets taken out of their life, they experience some kind of significant problems. So really, the distinction between drug abuse and addiction is going to lie within how much control the person can exert over themselves. All right. Since a person who just abuses drugs still has control, they don't experience all those problems in their life. In contrast, those with an addiction have a disorder that's affecting most, if not all, aspects of their life. They're usually missing school or work, family problems, financial problems, health problems, legal problems, all this kind of stuff, specifically because of that behavior. But despite all this, they're unable to change their habits or improve their situation. So that's the difference. And understanding these distinctions, like I said before, it's important when it comes to deciding what types of interventions we're going to prescribe for this person. All right. For example, since drug misuse isn't a disorder, well, something like a simple reprimand, or maybe like a light legal action or a fine, that might actually be pretty effective. If we're just talking about drug abuse, which is to say not progressed into an addiction, this is where information, honest conversation, stuff like that can actually be really effective. If you have not yet lost that control functionality yet, those frontal lobe cognitive functions are still intact, they're not damaged, they can be helpful. In the world of alcohol addictions, we might call this sober curious or like gray area drinking. Like gray area drinking, for example, is usually referring to somebody who's on the AUD spectrum, but they do not meet the diagnostic criteria for addiction. Okay, so for example, let's just say that there's a woman, 23 years old, who falls somewhere on the AUD scale. If not intervened upon, she will be in the full throes of addiction by age 30 in this example. Well, if let's say this person spends a lot of time on social media, okay, she's following women that she likes and respects and that she can identify with, accepts that her drinking, although it's not an addiction, it's certainly a problem. If she stops, we could potentially stop that progression right there so that it does not need to progress at that same speed that it otherwise would have, because up to this point, willpower and just that desire to, buy quit lit books and read them and listen to the speakers and find out what the drug is doing to our body, all that stuff, all that thinking stuff is a very powerful and capable force. On the other hand, for a person with an addiction, by definition, the willpower enough is it's just not enough to change that behavior, And of course, if the body is chemically dependent on a substance, well, you're almost always going to need some kind of clinical intervention. The brain studies are just unequivocal in their findings. I mean, you take someone chemically dependent on alcohol, and then you have them read all the best books, listen to the best speakers, their family tells them how much they really want them to stop, and they're, taking it all in, and they're sincere, and they really want to stop, and they're on board with the whole process. And then you remove alcohol from this person's life without making sure that they're in like a nice little safe container at the time. That motivation to get more alcohol now leapfrogs to just the front of their needs. If we talk about like Maslow's hierarchy of needs, it's now more important than family and and friends and community, and it's even more important than food. Okay, so like without a medical detox in place, the prognosis for somebody who's chemically dependent and addicted is just absolutely terrible. All right, so that's addiction. That's the severe form of addiction. That's my breakdown of use, misuse, abuse, addiction. The nuances are really, really important here because ultimately that will influence and direct how we can best treat the individual.